Aparna's work focuses on three broad areas, which is engaging extensively with state and national government partners, technology and domain experts, researchers, donor organizations, and others to set up data use cases and projects across sectors. Second being advisory on data accessibility, quality, and usability. Third, third being overseeing efforts to strengthen data capabilities within government agencies. We felt Aparna's expertise in these areas would be ideal to spark the imagination of many of us at eGov about using data in administrative decision-making. Aparna has also worked in development and environmental policy research in India in different positions at the Madras Institute of Development Studies and the Center for Microfinance at IFMR. And in Singapore at the Institute of Southeast Asian Studies. Aparna also has a master's degree in international policy from University of California, San Diego, and a master's degree in economics from Gokhale Institute in Pune, India. So without any further ado, Aparna, the floor is yours. And
thanks so much, Aditya, and really glad to be here. We've been talking about doing this for some time now, and I think the timing with the last few weeks was a bit difficult, and we said we'll reconnect in June, and I'm happy to be able to do this. So thank you to the eGov team. I've been tracking work done by eGov for the last many years now, and I've really admired the work that you guys are doing, especially over the last few years. With your expansion into a number of different areas. We have overlaps in many states now. So I think I've lost track, but I think Gautam and I have been in touch for 4 years now or something around that. And we're also close to thinking about how to formalize a partnership. And I hope this is one of the ways where I'd like to think we have already got started. So really looking forward to it. As Aditya was saying, a lot of my work and thought now is thinking about how to use administrative data better. As all of you are in the space, neck deep and hands and feet into generating large volumes of digitized data is really the purpose, is to see how that could change lives and how that could change how we make decisions in this world. So I think that brings us all together. So what I'm doing today is really taking you through some of our experiences through JPAL, through our interactions with state governments. Mostly, most of our work has been at the state level. It's recent work for us as well. Traditionally, we've been used to doing primary survey data collection. So in the last few years, as we've been thinking about the IDEA initiative, it's a way for us to pull our efforts into how we could do more and work with people like eGov and others on using data better. Both government and non-government sectors, but of course in India, the largest producers of data tend to be in government, so all of our efforts are also focused there. But in principle, we work with nonprofits and international agencies and private agencies as well. But a lot of my work, for instance, and interest has been in working with state governments. So I'm interested in the space of research to policy and what we can do there. So I do have a presentation. Feel free to interrupt at any time. It's really meant to be more of a discussion to create some ideation and talk about it and talk about each other's experiences in the space. So do that, use the chat window, or also just unmute and ask a question if you have that. And we'll, of course, I think have a section right after I present as well for a discussion. Let me jump right in. Great. So I think this is one thing we've seen in our lifetimes, and we still do see these reams of papers and files in many of these government offices that we go to that are being diligently computerized, I would say, at the minimum, if not getting digitized. But at the same time, we've also seen, at the same end of the spectrum, we also see the use of drones and use of AI and machine learning, which are quick buzzwords that tend to catch on in governments. So I think we see both ends of the spectrum, but safe to say that this tremendous growth in data arising out of such digitization initiatives. The open data initiatives, data.gov.in, was launched with a lot of hope that digitization would automatically also lead to data becoming accessible and available both within and beyond the government. There are, of course, many challenges, and that's sort of what we're looking into. But I think there's leaps and bounds of progress with technology, with just in how the data is generated that makes it available. So maps like these are becoming extremely common. This is actually ex-Jay Palari's work, who has his own startup right now looking at land records, but this was some of the work that he had done when he was at IDFC Institute, looking at just patterns in urban growth and agglomeration, just mapping along highways and public sectors. So, the kinds of tools that are available, not just with technology, but also statistics and visualization, is making data much more accessible and usable. And we hope that this improves, is one of the key things in actually improving usability. And I think that's what brings all of us here together. And as you would have, and I'm sure as all of you would have seen, has this translated into improved data use? And what do we mean by data use? And this is what I want to focus most of my presentation on, because the position I would say that we're taking with the JPAL is to see what does it take for data to be accessible and usable, and then looking at the impact of the kinds of decisions and innovations that could be introduced using insights from data, and what impact they have ultimately on beneficiaries and on development outcomes. So the COVID-19 pandemic, I think, has been, all of us have been, of course, watching this with one thing it struck me is that the amount of data overload that we've had during this last, I would say, year and a half or so, sets aside, of course, this pandemic is different for many other reasons, but probably for the first time in world history to have so much data. I walk in my neighborhood and people are talking about R values and about CT values on their scans. I think it's at a time where the local person talks about data, talks about indicators, but that has not necessarily translated into being better prepared or being able to take these decisions. So as you would appreciate, I think there are these challenges. So if I could, Gautam, I don't know if you wanted to weigh in on some of the things, or anyone from the audience itself, on what do you think are the problems? Do you think we are getting enough data with COVID-19? And if not, what do you think are maybe one or two challenges that are preventing it from being usable?
I won't weigh in on this. I'll let the rest weigh in. I'm going to put a question that I think would be of interest to me in the chat. And if you could speak to that during your talk, that would be useful.
Yeah, sure. I can now see my chats, but any thoughts on what you think are perhaps some of the constraints?
Scale with models in terms of revenue, etc. So, GovTech seems to be a domain that they are interested in purely because of whole eGov, NUI.
Sorry, was that a comment, or I think maybe was that by mistake?
I think that was Gayatri Doctor. Gayatri ma'am, could you try speaking again? We lost you for a minute.
Yeah, and the voice wasn't clear actually.
Okay, so Ameya has raised his hand. Ameya, you have a point you want to make?
Aparna, this is Chandar.
Yeah.
I think one of the, what you're saying is right. There is a lot of data getting generated. But I think there's also an element of too much data, and accuracy is often a big concern. So one of my questions would be, how do we drive processes and governance to get the right kind of data to get generated, reported, rolled up, and use it for administration.
Absolutely.
Administration, right?
So Ameya, I think you said you wanted to go next also.
Yeah, so I was thinking about how, even before the pandemic, if we look, then like only about 80 to 85% of deaths that were taking place in general were being registered, and a cause of death was being recorded in an even smaller fraction. I don't remember the number off the top of my head, right?
Mm-hmm.
But so, to even being able to have that kind of estimate, to be able to say, okay, my data is 85% complete. Let me start doing some stuff and start saying something intelligent, or like knowing how much to adjust my estimates. But with a lot of stuff that we're looking at in the pandemic, it's like we didn't know the base rate in the first place, right? So even if I'm supposed to adjust it, I just don't know by how much or how.
Yeah, absolutely. I think between the two of you covered, what I'd normally put into 3 brackets, right? You need the right data or the relevant data, you need reliable data, and you need it in a timely manner, right? That you get it in a way that you can act upon. And we've seen all of these challenges with deaths, of course. There are questions, many questions on reliability. People are starting to fix it now. There's a lot of reconciliation efforts ongoing. There's a problem with what is the right data for the right question. And that, I think, is perhaps been the bigger challenge. In a lot of cases, I think the reliability, especially on things like counts on cases and recoveries, has been good because it is coming from testing data. It is getting reported directly from labs to a central place. There are, of course, issues in how that data is being recorded. But at the minimum, I think those counts are good. And that's why you see a number of these dashboards across not just in India, but internationally, that are able to show these spatial patterns and descriptions, and we see the distributions, and we see the trends in data. So we have reasonably good descriptive data. But as a result, we've not really been collecting the kind of data we need on, say, contact tracing or transmission to be able to say what is going to happen next. And that, to a large extent, has also caught us unawares with the second wave this year. We also are still struggling with saying what should we focus on? Should it be health systems? Should it be vaccinations? Should it be economic support? Should it be education? Or should it be a bit of all of these? And how do we distribute our resources? And ultimately, that's the question which most governments also deal with, is we are still working with limited resources, and then how do we do that? And so a lot of these questions, when we're collecting data, it's very important to know what do we want to use it for. So what data are you collecting to what end is really as simple as it sounds, the one fundamental question. So there are a couple of examples that I noticed from both last year, and there are many now, I think, but these are rare to find on data use. So this was something that was done by researchers in April 2020, last year, even when just the pandemic had started, and it was the epicenters were in Europe and the US. And so Sendal Mullainathan and his his collaborators in the US simply looked at cell phone location data, as well as like business location data in the US, to say what is the footfall at, say, a McDonald's compared to a Walmart compared to a Chuck E. Cheese, and to look at that footfall data with, so sort of an intersection of density and how long people stay. So you have things like, obviously in a drive-through, you might get a lot of traffic, but they spend less than 5 minutes, compared to, say, a dine-in kind of restaurant where people sit and eat for longer and you might have fewer people in. So what they did with this data was to intersect the level of contact or the potential for transmission with whether the activity is indoors or outdoors. Kind of then gives you some working points to say, if I go to a sit-down restaurant, it is very high in terms of the level of contact I'm likely to have, and also the level of transmission or the risk exposure that I have because it's indoors, than say when I go to a park, where I'm unlikely to be meeting with someone else because I'm either going for a jog or a run, and it's completely outdoors. And this is what we've seen now through many meta studies as well. If you look at what transmission sources there are, parks and outdoor activities are among the least. Things like offices, indoors, gyms, and restaurants are the spaces where transmission is among the highest. So these are kind of things where you're trying to meaningfully combine relevant data into what we call indicators, which are benchmarks. These are variables that help you describe a phenomenon. So it's not number of cases, number of deaths only tell you so much, right? Once you start thinking about it in terms of probability of infection, or things like the source of transmission. These are indicators which then help you act on that information. And another sort of interesting example, I think this was a group within the World Bank that looked at a couple of locations in Indonesia and in Philippines, and they used Facebook data for population density, as well as a lot of crowdsourced information through OpenStreetMaps and the like, to map out where the health infrastructure is. And this is quite striking, actually, when I saw this graph. This was, I think, they'd written a blog sometime last year, which is the proportion of population which lives beyond, which has more than an hour's travel time to a health facility, and whether you're walking or bicycling, driving, etc. So I don't know if Indonesia is just motivated by a lot of traffic jams, or if it's just really spread out. So you look at also the cluster of the health facilities in certain areas, whereas people live all across the city. And Philippines, interestingly, this is must be obviously Manila, the NCR region in Manila, where it seems to be remarkably well spread out, and everyone seems to be, very few people are actually more than an hour of distance away from health facilities. And so these, for instance, will let you decide on things like, in times of COVID, for instance, emergency relief is extremely important. And this is something the UK did, for instance, was to say that we will reduce the load on hospitalizations. You have home isolations, and what you really need to then ensure is that you get to a hospital within an hour or two of someone flagging an emergency. And so whether you make the right infrastructure available or the right sort of health system response available for it, this kind of data is really useful to be able to look at that. So these are, I think, more of these examples and more of this sort of thing. And where JPAL comes in is to say that, you would take data to identify where these challenges are, especially combine different types of data and design interventions that could address these challenges. And then our primary goal is to look at what has been the impact of these innovations or interventions, and how cost effective are these, and are these scalable ideas. So I'm going to take like a few minutes, just because it may be a new group and not everyone may be familiar with the kind of work that JPAL does. And yeah, Gautam, let me know if any of this is repetitive, and I could skip these, but I'll just give the quick overview to this. So at the core of what JPAL does is research, and the research that we do, as I mentioned, are what we call randomized evaluations or randomized control trials, which look at the impact of different policy interventions or programmatic interventions we do this in collaboration with our implementing partners. But very early on, we realized that there is JPAL, the research network, but we're as vested in the idea of how this research and evidence gets used for decision making. So we have two other arms, verticals within JPAL. One is policy outreach, which really is synthesizing what we're learning from decades of research and what we're learning from different contexts, as well as combining it with the local context and understanding the situation on the ground, and how to make the most relevant research actionable and usable by our partners in India. JPAL South Asia, this policy team does that. And then similarly, we have a capacity building arm, which mostly trains and shares knowledge and resources on thinking about using evaluations and using data meaningfully in policymaking and decision making. So those are our three arms, and it was set up in 2003 at MIT by Abhijit Banerjee and Esther Duflo, who got the Nobel in 2019 for the use of this methodology of randomized evaluation. So we have about over 200 affiliated professors. So JPAL is essentially a network. So these are people, development economists largely, public policy experts, and from a few other applied economics streams, who are part of the JPAL network, tied together by their use of randomized evaluations as part of their research. And so in India, we don't have too many, but we have from the IIMs, for instance, we have a couple of affiliates who are based in India, but we have also worked with several researchers who are based in Indian universities who collaborate with the affiliate network. So very quick 1 minute on what we mean by randomized evaluations. So these are what you call ex-ante or concurrent evaluations, which are launched along with designing a program. So these are best done when you have a pilot program or when you're trying to design something. These are not ex-post evaluations. It's not possible to do an RCT after, say, NREGA has been in implementation for 15 years. We can't use an RCT to say whether that has been useful or not. There are different statistical methods to do that. The time and the usefulness of RCTs comes especially when you want to assess whether a new program is effective, when you're not sure of what could be the possible outcomes from it, is when to use the methodology. So to give you an example, what you do is you start with a cluster of either individuals or households or villages. So let's say we're getting households to adopt green practices. So whether it's more recycling or waste segregation, what you would do is you would start with an area where you want to bring about this change in a group of households. Half of them at random are selected to receive the intervention. So the intervention could be something like, let's say you incentivize people to recycle, or you incentivize them to segregate waste. And the other group is your business as usual, where things go on as usual. Or you could have multiple interventions. So you could have a business as usual group, one group that gets an incentive to recycle, another group that gets training, another group that say gets materials or detailed instructions, or they get reminders. And you look at the relative cost effectiveness of these different interventions. The key point is that these two groups are identical to start with, and it's only the exposure or the introduction to the intervention that sets them apart. So statistically, this is sort of considered the gold standard in attributing causality to the program. So if you want to know whether there was an impact of providing incentives to a certain group of households on the impact of segregating waste, and of course, eventually on outcomes of, say, cleanliness or sustainability, then this method of a random assignment to the treatment is what tells you with confidence that what is the percentage that is attributable to the intervention itself.
Aparna, one question on this. I think it's important to understand when you think of government programs which are designed to actually cover the full population, right? And so even in that sense, control and test kind of or an intervention group will require can only run for a certain amount of time before the government wants to expand. How do you deal with that?
Absolutely. So that is one of the key challenges we have. A lot of the time, so it depends on the intervention. Something like an information intervention, you only need to run for, say, 2 or 3 months, and you start seeing impact on take-up. And that's sort of the beauty of the randomization itself, is that once you've randomized, you can actually track outcomes for the group over time, right? So the intervention, so something like an academic intervention of using EdTech, we would run for the full academic year to start seeing impacts on things like learning outcomes. So you would need that intervention. But after that, let's say after a year or after 2 years, it gets scaled up to everybody. But 10 years later, you can actually track the group that was in the treatment cohort to see what was the impact on their, say, learning, earning potential, or whether they completed college or not. So there are 2 things here. So one is, it depends on the outcomes that you're interested in, which defines the duration of the intervention and therefore the duration of the study itself. And then there are longer term outcomes where the intervention doesn't have to continue, but you could still track those outcomes over time. And often it's a negotiation with the government, of course. So it becomes a prioritization of what they're interested in measuring, and therefore this thing of, what is really worth waiting for. And typically now, I think nowadays a lot more we see, especially with my engagement with the Tamil Nadu partnership as well, is that once they've started seeing the value of what the evidence can generate, they start finding the mandate and the interest in doing pilots as well. And of course, when resources are also constrained, it also makes political sense to start small, test it out, and then scale it up across the board. But there is, of course, an urgency, and it depends on the nature of intervention. So things that are, of course, sensitive, which we know for a fact is very useful for everyone, we don't recommend that we do an RCT for that. And often you do like the pluses over it. So for instance, there's a basic intervention that goes to everyone, and then there is an additional, let's say, an encouragement or an additional feature that you then test out.
Understood. Thank you.
Right. So yeah. So that was my 1 minute or 2 to 5 minutes on theory of RCTs. So this kind of work we've now been able to do. There are over 1,000 ongoing or completed evaluations around the world. So just like JPAL South Asia, where I'm based, there are about 7 regional offices, and we work across many sectors. So agriculture, environment and energy, governance, crime, gender, finance, and a few others. And so South Asia was the first office to have been set up, and that's also where we have the largest number in some ways of one country of the number of evaluations we've been able to do. And so we're headquartered in Delhi and in Chennai. So we're hosted in India, just like in the US, JPAL is hosted by MIT at the economics department. In India, we're hosted by the Institute for Financial Management and Research. So we have a local host university in every country where we have an office. And so we have, as JPAL, we have a few large offices where our staff are spread out. So we have about 9 of these offices across the country. And then we set up project offices wherever we have a cluster of activities going on. And then we work with many, many state governments across the country. We have large institutional partnerships with about 3 state governments where we work with multiple departments across multiple sectors. In a number of other states, it's usually a department-specific engagement on 1 or 2 projects. So somewhere we'd work with the health department or with the, say, the education department in another state. And so that's the 22 sort of partnerships that we see. And then many civil society partners, nonprofits that we work with. Across the country, we have over 150 staff spread across, and we work with field investigators or surveyors who collect this data.
Aparna, very quick question before we dive further. I guess one question would be, can you give us an example of policy change that has been recommended basis RCT that has had a significant impact in India that we might not know was driven by an RCT?
No, good point. I should have had a slide on that, which I've missed. I'd encourage people who are interested to also look at the evidence to policy page on our website. And that is a collection of both things that have gone to scale as programs, but also learnings from a group of studies that we have. So that's like a nice page to see things. One of the examples I'll give you is from, let's say, education. Which is almost scaled up countrywide. And so this we worked with Pratham and looking at this one single type of pedagogy, which is largely what we're calling teaching at the right level. And so this takes the principle of saying you group children by learning ability and not by their age or grade. And that simple reorganization of using an assessment test to group by learning ability, and therefore they learn at their pace. It shows them to catch up with, especially on math and and language abilities. They catch up with the others in their cohort by just doing the simple pedagogy. So this pedagogy of teaching at the right level, we've tested with many different things of just doing that, teacher training, or providing textbooks and the like. And that pedagogy is now is the most effective in terms of improving learning outcomes, and that is now scaled up both by governments as well as through Pratham independently across almost all states of the country. And so we have something similar for school-based deworming. We've done for NREGA, it's a fund flow mechanism that has changed. And then similarly, we have for pollution audits and targeting the ultra poor, which is a grant-based program for moving people out of the bottom poorest, so poorest of the poor. So there are about 7 or 8 of these scale-up stories across the world, which comes from about 10 or more evaluations that have been done on a topic in different contexts over different times. And then we have many, many more studies which have more insights on things like are conditional cash transfers good or not, how to think about universal basic income, or how to think about let's say information messaging and targeting and things like that. So moving on, I think a little bit on, I wanted to give you a few more of these examples really on, so these are some things, I think there's one example we can maybe even talk to you about how it is, it's now become part of practice and use. But this is work that we started a few years ago. Researchers are typically very interested in looking at how to use administrative data better. So as I was explaining, when we measure impact on outcomes, we would traditionally, in the absence of data from the governments or the partners that we work with, have teams of surveyors interview individuals or households with these questionnaires, and then we analyze that data. So these would be discrete data collection activities, say at baseline, midline, endline, or at a certain frequency of surveys. With the large volumes of transactional data becoming available, and we're also seeing that there's a fair number of not just demographic or socioeconomic information being compiled on beneficiaries, there's a certain level of outcome data as well. So for instance, frontline workers using health systems data or capturing health systems data There's information both on beneficiaries, but also on, say, immunization status or their health records, or could be their treatments. So any number of things, and then of course their height and weight measurements, things like that, which when interventions are introduced, you could use information from such systems to measure the impact of those interventions. So taking you through some examples of what we mean when we say admin data use, as we've been discussing, the growth in data has not necessarily resulted in the growth in its use. And we think there are a number of constraints, reasons for this. Right? One is that data itself is not collected in a manner that improves its reliability. So you could have the frontline worker, you could give her a smartphone app, but some of the same problems that you have in collecting on paper data will also translate into your digitized system. So often we see a lot of clustering, for instance, on anemia levels or malnutrition levels. And that's because it's easy for them to round off rather than do an exact measurement. Right? Then you could have instances where the data collection is actually good, but it's an overload of data, as Chanda mentioned. Right? So you have too much data, which is thrown at the say the manager or the decision maker, without it being organized into meaningful dashboards. So you have some level of dashboards which the person who is developing the systems thinks is useful. There are actually multiple levels of users within government, and that data is not necessarily speaking to the different use cases. So at a district level, you want to look at, say, things like just have the inputs that I have received been sent out when it should have. Whereas at the state level, you probably want to look at which subgroups of populations are actually accessing rations, when are they accessing rations, let's say with a PDS example, or through the ration shops. They want to look at things like, where are the exclusions, where are the gaps, is there fraud, is there leakages and stuff. And so that, unless someone's actually thinking about these different questions, and so who is using the data and for what purpose, we don't often have these dashboards speaking to the decision purpose. And I'm sure if somebody has, if you have these determined, and we've seen many of these determined government officials spend their time and organize it as they need, but it often dies with them, right? Or it happens for 3 months and then it doesn't sustain. And eventually you have things like, unless you see the value proposition of it, right? As Gautam just asked, it takes a little bit of time and patience to deep dive into data, think about where the challenges are, and to then design, pilot, evaluate, and scale up a successful innovation. And it's not often clear to people as to why they need to do that, right? Unless there is especially in the absence of incentives to do it, or in the absence of a reward for doing it, it's often perceived as a risky thing to do, and you don't actually see the value to it. And so this is what you think of as how to get from data or information to actually deriving insights and wisdom or use of data. And so this last box is where typically JPAL's value add is, and we want to work with tech providers and with other people working in the space of tech and data to see, can you fix a lot more? What can we standardize around data reliability and usability by building in systems for validating data, even at the point of collection, or through systems like high frequency checks, things that we use in research to ensure usability of data. And of course, on analysis, just defining indicators upfront along with the data systems itself so that it improves or it encourages meaningful visualization and use. So to take you through a few, I'll take you through quickly through a few examples. So, some of these cases, this I'm going to skip, but just to tell you that call records you would think are done quite often, and we work with the women's helpline data in Tamil Nadu to look at it, to see what kinds of calls come in, how quickly they respond. But here you have first order problems of even how the data is recorded. So when we started working with them, people were just entering things into an Excel sheet, and often so domestic violence itself was recorded in 25 different ways. And so there's not much you can do with data like this, right? It's semi-structured, or it's barely just ordered. So first order efforts are even trying to help codify it properly, keeping in mind the indicators and what we want to measure, not just how many calls came in and how many were answered, but really what kinds of calls are coming in. Are they being referred to the right groups? One of the things that came out of this, which took us by surprise, was just the proportion of prank calls that they were getting. And half the times of the operators just went in, picking up that call and stopping it. So once, at the end of this exercise, they had also invested in a proper MIS system. And so things like, ability to block a call once you know that it's a fake call or it's a prank call. So there are a number of first order issues to resolve there. Then you have reliability issues. So we looked at applications for affordable housing. And this was from Chennai. And so this was manually collected by the corporation officials. And so, and of course, they hadn't collected GIS data, but since we have techniques available, we tried using the addresses to then put them onto a map and to see if you could see where the spatial patterns for applications were coming from. Were they largely coming clustered from certain slums? Were they coming from across the city? And unfortunately, again, what constrained the analysis was that because the addresses are not recorded very systematically, we had some people landing up in the sea, or that, we weren't really sure. More than, I think, 50% of the addresses were not usable. So this plotting was really with just about 30 to 40% of the addresses, which means then that it's not a representative sample, right? So you can't actually draw any sort of interpretation from it, but we did this just to sort of show the value of how very quickly you can visualize patterns of or clusters of applications to a program, and then you could take decisions on whether you need to have more awareness programs or whether think about equity and distribution issues. So I'm going to do a time check. Is it all right if I go on for another 10 minutes or so on the presentation side?
Absolutely. Please go ahead.
Okay. Yeah. So that's so these are two examples where I'd say the data, there's a lot of potential, but even to get it to this like usable phase, oftentimes some of the values also, when not to use data, when it is not reliable, and to flag what are the issues and where are the problems in it and how do you correct some of these problems. So a lot of our effort also actually goes in building this capacity with partners to say, what are some practices that you can put in, either with technology or just behavior change practices and how data is collected and recorded, which could improve usability. And all this time, as researchers, we have a use case in mind, right? We're thinking about how this data could become usable. So in this case, in the housing case, we had this question of saying, can we look at affordability and willingness of people to pay for, say, a housing, or could we have different models of housing that could look at, increasing accessibility and sort of doing some sort of cross-subsidizing. But we didn't even get to that question because the underlying data needed working for. When we are able to use the data, so this is an instance of health insurance where, as all of you would know, there's typically either a third-party administrator or there's a fairly decent transactional database or NMIs that is being used. And so this is two of our researchers these are professors based in the US, Pascaline Dupa, who heads our health system work, and Radhika Jain, who also is a postdoc now at Stanford. So they looked at the health insurance data under PSBY, which is now, of course, under the PMJY scheme, and combined it with post-hospitalization call surveys. So this is an example where you combine both administrative data and what we call survey data. When you call beneficiaries directly, not only does it validate information, it also tells you like challenges that you may not have otherwise come across. So one of the two striking things I'll highlight from what they did, they looked at things like out-of-pocket expenditure and quality of care and things like that. But just looking at the administrative data itself, the left side of the graph, don't worry about all of the smaller figures. I'll tell you basically what to look at is that the smaller blue dots that you see moving like this, it shows the proportion of women who are using the insurance scheme. So basically, people who are not in the reproducible age group, right, and in the reproductive age group between 30 to 50, there's a sharp drop in women accessing the scheme. Now, is it because they don't know, or is it because their health needs are not prioritized? We don't know, but there's clearly a gap, and that is actually compared against, say, the NSS data as well as the census data to compare against the proportion of women. So proportion of women in population and proportion of women who are accessing the healthcare. And then from the provider's side, the interesting thing was the Rajasthan government, as most health departments do change the coding of the prices of different packages that hospitals can offer. So sometime in 2017, for instance, this is again, I think, packages for women. and they changed the basic package from 6,000 to 9,000 rupees, and a comprehensive package that went from 7,000 to 12,000 rupees. So you'll see this sudden sharp rise in this yellow line, which means that the hospitals are very quickly changing their coding practices, responding to price. Now, this might seem like an obvious thing, but obviously has huge ramifications. So we don't know if people were just providing a service and coding for something else, or were they actually prescribing the procedures that were not needed. So this sort of extremely high sensitivity also tells you something on how much of monitoring is needed, or what kinds of checks and balances are needed by the health providers to monitor the hospitals that are actually implementing this scheme. And so this is something, for instance, this is some work now we're trying to do with multiple state governments to say, could we have a permanent call center embedded within the health insurance teams to look at a range of these questions on whether people are paying out of pocket, what kinds of rates are being charged, and the like. To give you another example of, so this is again a stage where, for instance, we've not yet got into an impact evaluation. So the question here is to both look at awareness and measures to monitor. And then again, you would look at the administrative data to see, has that had an impact in reducing either the coding malpractice or usage among vulnerable groups. To give you another example, which perhaps from the kind of digit platforms and things that e-governance builds on, and this might be a little bit more relatable, is a long-standing collaboration actually between the city of Cape Town and JPAL Africa, which is based in Cape Town, actually, interestingly. So we have Kelsey Jack, who's one of our affiliates, who's been working with the Cape Town city government to look at a number of issues, but they started first with electricity. And so there was this question on saying, if you switched people from postpaid to prepaid meters, what does it do to consumption? And what impact does it have on revenue for the utilities company? So as expected, with a prepaid meter, the daily usage actually drops, and you see that pretty sharp. So this is the point at which people switch to the prepaid, and their median daily average usage of electricity drops. But interestingly, it got paid off, or the impact for the revenue company was evened out, because what they were able to do because of this was their ability to recover a lot of the outstanding debts, because people were putting money up front and using as much as they could, right? So that actually offset the reduction in the usage. Whereas in the past, they were ridden by these bad debts, which obviously, they have had much limited capability to recover those bad debts. And so this was actually evaluated. So a certain group of those, so that methodology that I showed you, so when the city government introduced the prepaid meters, they were also not sure on how well they would be taken up or they would be used. It was introduced for a certain group of households in certain neighborhoods. And then they constantly looked at the monthly utilities bill data. And then they combined it with some surveys wherever needed to get beneficiary level perspectives. But the essential outcome data, which is usage of electricity, comes from the administrative data. So the only thing that the partner needed to do was randomize where the introduction of the prepaid meters were. Now, of course, it is scaled up. They decided how to do it. There's a strategy. They similarly built a water use dashboard. Again, there's some experiments around it. Some of these programs are ongoing. So a number of these utilities, they now have an ongoing arrangement, both things that the city government itself does, but also in collaboration with a number of researchers. And then, so similarly in India, we don't yet have results to this, but in Bihar, for instance, we're working with the state power distribution company to look at the impact of, group incentives. So this is through the feeder system, where instead of a meter, you have a single, a meter for a neighborhood. And what the researchers are trying to look at is saying if the quantity of electricity available to that neighborhood or the supply actually depends on the share of the bills paid, or how much the households are able to pay the electricity dues. So it's sort of leveraging this concept of a group incentive. And then it also incentivizes the employees of the power company to invest more in some of the power recovery charges. And so we're looking at what, again, similar to the South Africa example, you're looking at what happens to usage and what happens to revenue recovery for the electricity company. And all of the measurement of outcomes for this comes from the data that is there. And in the admin data, we're finding that there's actually very good data, obviously, on the utilities consumption itself. But things like the beneficiary information on things like phone numbers or their addresses is not very well maintained. So we're needing to use a combination of both administrative data and household as well as employee surveys for the study as well. So I'm going to stop with this last example of as a practice of what we're recommending highly, and this is coming again from work that we've done in Telangana with the Raitu Bandhu scheme, which was essentially the government giving, I think, 4,000 rupees or so to every farmer. And so Karthik Muralidharan and others had studied this model where they introduced a very simple intervention. And they said, we will have a call center that calls, many tens of thousands of farmers, literally is calling and asking, have you received your check? When did you get it? How much was it? And a portion of the extension workers, the Mandal agriculture officers, about 25% of them were told that there will be a monitoring system like this. That's all they were told, nothing else. They were just told that somebody will call and verify directly with the beneficiary. And this itself improved both the receipt of the check by the farmer, and so the number of farmers who actually received the check, and they received it in time. So the main purpose of the scheme was to make sure that they got the money in time to buy the agricultural inputs. So this, for instance, a very simple intervention. You could do multiple things, for instance, then combine things like this monitoring with either incentives or penalty packages for non-delivery. All of these things, there are many interventions that you could do to improve last mile delivery. And these are extremely cost-effective interventions, and governments are already used to the idea of grievance redressal portals. What we're saying is flip that around and make it a more proactive call center based, like calling model, where you are directly get feedback from the beneficiary, and then you use the admin data and validate it with the beneficiary data that you're getting. And we're seeing remarkable impact on just doing very simple interventions like this. And of course, they need a little bit of effort and hand-holding in setting it up at front, but we think this is an easily sustainable model. So these were a few examples just to give you a flavor of what we're trying to do. As you can see, we're at all ends of the spectrum, starting working with very limited administrative data to much more advanced systems. For instance, we're also working with tax systems data, with employment portals. Energy and environment is another promising area. Crime, again, you have through the CCTNS and other similar platforms. There's a lot of potential to engage. And so we've been talking with eGov, of course, to see how the Digit platform and other things that you are working on could be leveraged for research questions like this. And so it really looks for coming together of the policy questions, the tech platform, data availability, plus the researcher interest. And that's how some of these ideas generate. So I'm going to stop there, but just leave you with this one slide on what the IDEA initiative does, which is we're developing a whole bunch of guidelines on how to use administrative data. While I've been talking about data usability, it's extremely important to keep in mind privacy and data security for use both within the government and externally for non-commercial purposes. And then we also do these experiments. So we think the biggest value add or the value proposition is demonstrated when you partner with governments to do these data use case projects. And then capacity building underlies a lot of our work where we're able to do some of the knowledge transfer and build some good practices within government. So whether there is a research engagement or not, some of these practices actually stick with government. So I'm going to stop there and happy to take questions. I know I saw a couple of questions coming in, so I'll take a look at that, but happy to take comments, thoughts, and questions.
Hi, Aparna. Hi. Thanks. This is, I think, really, really enlightening. I think one of the things we kind of think quite a lot about is how do you empower the actors in the ecosystem with data at scale? Because this is the issue, right? I think after all, how many, surveys can you do? How many, municipalities can you work with? So are there any good examples of, I looked at some stuff in the US and it's very local. They've got local CTOs and CIOs and stuff like that. So would love to hear because that's a question we are always kind of asking ourselves, how do you do these things at scale, right? So any thoughts, any experiences you have will be really useful to kind of get your views on that.
Yeah, absolutely. I think that is the one question. So a couple of things we're doing, I think, both with health insurance as well as crime data. So one of the things to leverage, I think, are these standardized systems that many state governments are using. So whether it's under PMJY or CCTNS or GST for that matter, things that you can demonstrate in 1 or 2 states are then much easier to scale up in across the country. So one of the things on which is an easier example to talk about is use of machine learning. That's a common interest, I think, both in tech, government, as well as research side. So we're looking at combining machine learning for identifying fraud in tax collection and tax suppression and like. So that, for instance, once you've tested the model, it's really about just integrating that by demonstrating cost effectiveness. I think one of the things is not just about the pilot, but also making it relevant to the use case. So cost effectiveness is usually an important thing that shows people, and then the handover, in some ways, the sort of the capacity building on making that change. Similarly in health insurance. So some of the work, for instance, which I talked about, like these call centers, just the way that grievance redressal or public helplines have become a common thing now. I think some of these practices, we've, at least from JPAL, I think, taken the view, and we've traditionally done this, is to demonstrate with a few projects, and then really, it doesn't go to scale immediately. Obviously, it never goes to scale with writing a research paper about it. So there is this phase of, we provide support sometimes at a light touch, and often depends on who's on the other side. So if you have a strong implementing partner, it helps to have something like an innovation cell within government. Somebody's job it is to use data and think about new program design. And so this, we're seeing signs both in Punjab and in Tamil Nadu, which have tried to at least set up these units. And then I think there's some push from Niti Aayog as well in trying to do this, where you integrate the use of innovations and design and evaluations as part of either the finance department or the planning department. And then often we see that sometimes in some of I think tax departments do it constantly, but health a little bit, we're also seeing these things. So it's this combination, I think, of saying, presenting what works in a way that is making policy sense, and also having this support. And who should play the support is often a mix of implementation expertise and, say, monitoring and evaluation expertise to incubate that a little bit until it becomes scale.
Also, I think, is there like Punjab is DGR, which is an institution. It's got an institutional mandate to actually do governance reforms. So I think, I don't know how many states have that. So I think this is something we like about Punjab, because they have this DGR team, which has very good mandate. And they have kind of figured out a way of working with the line departments in terms of how to kind of, do things at scale. So I think,
That's you have these nudge units in the UK, for instance, that do this. In the US, the President's Office sometimes does this. In Indonesia, for instance, we have the Office of the Vice President, which then engages with researchers. So sometimes it's at the political level, and I think from an institutional perspective, it makes sense to have it at a department level, because then it sustains regime changes and the like.
Yeah. I think, Gautam, what we should do separately is on India Fiscal Information Exchange, right? And Punjab is the first state we're doing it. We should have a separate deep dive, because this is where we have a chance to put defaults in a platform. See, one of the problems we have is, the kind of, when you get a window of opportunity, you build something which basically, really gets the problem solved right at that point in time. So a lot of time, these things around building defaults in the platform, which will basically enable data empowerment, right, are almost like so iFix is essentially, in summary, is a fiscal exchange platform where all the fiscal data, because one of the issues with the fiscal data is the cost of coordination is so high that by the time the Gram Panchayat knows their money has run out and they have pulled the budget out, it's like 6 months and the water has run out, right? So we're doing something, it's very bold, and Winnie has been very, very supportive. We've been working with us last 1 year, and she's got another 3-4 years to go, hopefully, right? So I think we're doing with Punjab as a first state, as a POC. But what we want to do is actually don't give the state the option of choosing whether they want to put this data out or not for usage or not. Actually have some defaults, which is sensible. It's not that we want to put all the data out there, right? But it's I think we'd love to work with you to say how to kind of, create that, pull and some kind of default, which basically at the later stage, people can use the data to, rather than going around and saying, "Arey, mere ko water department data chahiye, then I need the electricity data," and stuff like that.
Correct.
So I think a really good conversation if we can do that, Gautam.
Yeah.
Yeah, we'll set that up.
Just to, touch upon what you said and also what Gautam asked earlier on the chat window. So, some of these, I don't know if there is a country where all of these things have come together, or I can give you an example, but what we do see, right? So the kind of both with DGR, but also this Punjab Innovation Mission, for instance, which has been set up for startups. So you want to have some of these innovation cells. Tamil Nadu, for instance, set up a innovation initiative, which was largely internal looking, which was for departments to compete against each other. So you want something like that, both internally as well as externally. Certainly, so you need the funding piece tied up, which is out of budget. It's an out of budget cycle for these discretionary sort of expenditures, but tied to innovations and pilots with a strong lining on evidence. And collaborations is the other piece. And I think that governments are also now learning to work beyond the consulting mode, which is I have an RFP, let me issue a tender and invite people. You need some of the thought partners to engage early on. There, I think the Punjab model is interesting, of these governance fellows and, CTO and CIO, which can come in where you bring in people for a short period. And we are actually in this space thinking of data fellows. Could we think of embedding people in departments for a period of 2 to 3 years as data fellows who pursue the research policy agenda? And then in that space, do some of the transfer. And I think on the system side of things, and which is the other thing we should talk a little bit more about, is how to implement these data policies, which is literally a cataloging of data sets. You don't need all data to be public. You don't need all data to be open. But what you need is know what's there and how to access it. And that I think is systematic.
So I feel Punjab, this kind of India Fiscal Information Exchange gives us the option to really put a blueprint in. I think so. I think we should just think a bit deeply about it, whether we can do a joint kind of pitch to them in terms of how to go about doing this, because they're doing a bunch of things, but it's still like typical government. They just Parminder goes and does something, and then somebody else just goes and says something. So I think if we can, since it's de novo and it's not like operational right now.
Correct.
I think it's a great opportunity for us to really, go together and just, create a exemplar of how it can be done at a system level.
No, absolutely. And fiscal is a great place to start. I mean, finally it ends up there,
Absolutely.
Yeah. And I think there's also another question on the women's helpline data. Yes, absolutely. I think this is very sensitive data. And so there are two sets of issues, and you're absolutely right in pointing out. One, there is what data, like, what do you think of data? What do you think of as data? In this case, this is much more, qualitative in some ways on what kinds of issues people call in with. So in fact, one of the things we did do for that team was to codify things up front, right? So you have a space where you're, of course, writing down or recording what people are talking about, exposed, but you put them into certain categories. And that mapping to categories is something that everybody should do systematically. And so there are both of those issues. I think the issues we were dealing with was even more first order, which is just not even recording properly. And then comes the issue of then, how do you do this sensitively and in a way that you're not losing the original purpose of it.
Aparna, I guess what will be very useful for us is also just kind of understanding the aha moments when this starts to click for different IAS officers, and how do you actually move them from a space of reaction to actually thinking proactively, and what are kind of pointers we can use? Because this conversation you're having seems to affect us across the board in multiple programs.
Yeah, I think, sometimes I keep saying that's, you wait for the aha moment, pretty much. It's a combination of some, at the beginning, of course, to be able to identify the right champion. So in Punjab, there's Vinny Mahajan who does it and who's already thinking, few steps ahead, right? And that's the kind of people you want, and you leverage their direction, and whenever they're in positions to be able to influence some of it, you just ramp up your work at that point, and you're building those use cases. The second is persistence, is what has helped for us. I think as researchers, we have a lot of patience, so we're just there, and and I think I keep saying e-governments also has found a way of working with governments longer term. So that long-term perspective is really important, right? And to know that you're there for a common agenda, and it's not just about meeting your goal, and you're meeting this common goal. And so a little capacity building is one of the values that we've seen paid off. So a lot of my work, for instance, in Tamil Nadu went with working with the evaluation department there, and just improving the way they think about what to commission, how to commission. So it's not even work that was directly related to the projects that we were doing, but literally saying, here is our experience from running high quality evaluations and what is relevant to the government's purpose, and finding this space where we find this match where we are able to share the expertise and it's relevant to them. So some of this public good also engages people, right? And finding this hook of what's interesting. But I do think the biggest wins are from demonstration projects. So of course, it's a hit or a miss. Sometimes when we do evaluations, we end up finding that it has no impact. And so then we're sort of back to square one, when it's not so interesting to policymakers that when you say, but you still learn something from the data. So that's a little bit of a, people have to be in it to learn something. But that value proposition of showing, and I think those feedback loops are important, right? And that's something we constantly tell our researchers. It's not about starting at the beginning and then coming back a year later. It's really engaging them in the design of the question and the implementation. And that is a challenge. Of course, they have 100 things to do, and having a setup where you can engage, even if it's like half an hour a month, that interaction becomes important, and finding this common goal. So I know I'm giving you a very vague answer, but I think it does depend context to context, and there are some of these best practices you can take away. But I think the examples that we have with both with some of the governments, in Haryana government, for instance, has come back to us on health systems data just by this one project engagement we had on immunizations, where they then set the research agenda, and they said, could we work on improving health systems data? So I think there is definitely a change where governments are also becoming much more proactive and demanding in what they want to see, and becoming discerning about what they can get from different players. And I think it's like finding those opportunities and finding the right funding and the right set of people. And also training people on both sides. I think both private sector and public sector, getting the right skill set becomes important, and matching the two.
Got it. Just on that, do you run any courses that help people think about how to do decision systems in that when we are thinking of designing them, or how do decision systems work out? Then we'd love to participate in those.
Yeah, absolutely. A little bit more focused on the evaluation and evidence use. So there are a few of these open enrollment courses that JPAL runs. Through the IDEA initiative, we're developing some of this material and case studies. There's the handbook on administrative data use, which is available publicly on our website. You'll find a link, and I'll also share it after this call. That has a number of case studies actually at the end, in addition to the technical chapters. And that really does a deep dive into how the partners came together and what it took for that partnership to work, and how the data systems was set up. And so those, I think, you'll find very useful, especially in some of the sectors. The electricity example that I talked you through for the South Africa one is explained in a lot of detail in the handbook case study. And then they have a set of pre-recorded webinars also that you can look at. These are half-an-hour talks on each of the case studies, which are useful. And then finally, we are coming up with material that could either be lectures and small videos on administrative data, particularly, and data use. And I will keep you posted as that develops.
Amir, you had a question?
Yeah. So Aparna, you mentioned this in passing when you were talking about the handbook as well. But there is the entire privacy and like, if any of this can be drilled down to somebody's personal data, sort of ramifications of this, right? Yeah. So one broad question would be, if you can give us some sense of like what do you advise governments as good practices on the privacy side. And then I have like one more specific technical question, but I'll come to that after.
Right. So I think one is, of course, keeping track of legislation. I do think with the personal data protection bill, we'll see some movement, perhaps, if not this year, next year, which will lay down a lot more guidelines on use. So research is very strictly guided by what we call our institutional review boards. And I think that's a good practice to take for any sort of data analysis. Governments obviously are exempt from it because it's internal data use. But in order to enable governments to share data, a lot of the times they're looking at credible partners. And a lot of the times, for instance, their interaction with JPAL is knowing, they're not getting into the details of how exactly we're doing data protection and systems, but knowing that we will take those measures in place. And a big part of what we do are these ethics reviews and institutional review boards, data audits, and those are some practices which both make sure that you have systems, of course, that are protecting against leakages and against vulnerabilities. And then on personal protection, I think there are a few different things. And one of the things we're trying to organize this into are these 5 safes framework, also mentioned in the handbook, which talk about data protection at every level. So it's not just at the point of data access. And I think that's important to keep in mind, but also during the course of data management on use, on what things to put in place. So traditionally, we've had these statistical disclosure limitations or SDL techniques, and we can talk separately about that on how to encrypt as well as de-identify data. And then there's more recently with I think with machine learning and advanced techniques on this differential privacy, where you have ways to bring about noise in the data so that no record and nothing is attributable to a single person. So there's a wide range of methods that are actually available and this context specific.
Great. KL Rao had a question, and KL Rao leads the PFM work that we were talking about.
Hi. Nice. Thanks for the session. It's wonderful to see the kind of work that is done by JPAL. I'm aware of the work that you guys have been doing. A couple of questions. One is in terms of the entire PFM space itself. It's been almost last 15 years I've been working with various finance departments in this various states. See, the most difficult question what we find always is at one level, like Rajasthan insurance kind of work is there, which is very specific, an instance that is there. On the other side, very high level, some kind of public expenditure, financial accountability assessments are there. But in between, if you look at specific instances of somebody working really with tons of data at the national level, there is a lot of data on the public financial management system, very granular level data. On the other side, with the state governments, a lot of expenditure data is there. So at a broad level, is there any work that is done, to help essentially the finance departments on the expenditure side? Revenue side, I know a lot has been done. Even in Punjab, JPAL has been working and a lot of center of excellences are set up, leakages are plugged. But one of the areas which has been for a long time issue is on the expenditure side at a broad level. Like for instance, with DBT, a lot was expected in terms of getting policy inputs. But that initial euphoria is gone. There is tons of data. Again, Manrega, so much of public data is available. Very few people sit down and do analysis. In fact, recently, one of the interesting paper I've just read on very poverty itself. In India, the poverty has been defined at 2011, and National Family Health Survey does in a different manner, and ration cards are issued in a different manner. And a very simple analysis has shown that in Tamil Nadu, there were poor who don't have ration cards are around 15-20%, those who are missing. Yeah. So these are something which are available, but not being used, especially a lot on the expenditure side, because we are short-sighted. One budget cycle is over. That's the end of the story of expenditure. So this is IFIX is the India Fiscal Information Exchange, which is part of the PFM transformation mission in Punjab, is trying to look at both this micro level, getting that basic information, and then use that in a manner where it really in real time provides policy input, not for the finance, but the larger public as well. So, JPAL has done any kind of work on these sides of it, expenditures or,
No, it's a great question. And I think in some ways that is also what we hope to achieve through these institutional partnerships, right? Because when we work with one department, and a lot of our work ends up becoming with the implementing department or the line department, which to a large extent has the implementation under control. So anything around course correction, that is the department that takes the action. But the challenges are exactly this on, how do you rationalize expenditures across these multiple programs? And so we've done this in a few cases where in health and education, traditionally, where we've had a lot of experiments around the world, we have enough synthesis to show if you have to improve learning outcomes, should you be investing in school uniforms, in remedial education, in health interventions? So we're able to look at about 6 or 7 of those interventions. And interestingly, it was actually deworming. School-based deworming was the most cost-effective to improve attendance and therefore improve learning outcomes. So that kind of work is fascinating to do. And we are trying to do more of that. I would put this into 2 categories, actually. So some which are the program implementation, which then just requires working with multiple departments and then looking at the synthesis across. So in some ways, it's great to have a finance department to say that our priority is actually, say, just to pick an example, adolescent girls education or early childhood development, and say that this is our budget, what are our biggest bang for the buck interventions. So some things we already have existing evidence on which could be drawn on, and some you want to do pilots to do that. So then you need this sort of 3-way engagement with the finance department or the planning department, say, which it comes up with the schemes, and the implementation done by the respective line departments. And sometimes these could be different. You can have health, education, and social welfare, or women and child development. That sort of agenda setting is what I guess, what we were also talking about earlier is nobody's job to do, and how do we get that done? And there's a lot of potential for that. That's easier to do. The other set of things that we can do with finance departments, we've done less of. We've got one study with NREGA, for instance. When we did this in Bihar, actually, when Santosh Mathew was in Bihar, and a very simple fix on, we were seeing low demand for NREGA simply because when they got the money from the center was much later for when the work needed to happen. So a simple fund flow fix at that level, we were able to demonstrate that it improved both demand and the execution of work, and that actually got scaled up at the national level very simply. So that was just one experiment we needed to do. With DBT, there are a few examples going on. That is also, again, at a sector-specific level, which we hope can inform the DBT debate. But like you said, I think there was a lot of initial steam, which and the evidence was also not caught up on it. So once we do have some results, I think from some of these early stage DBT experiments, we should have more insights on what could be done. And the other area I think is universal basic income, which there is a lot of interest in now. That is led primarily by finance departments, and it will require some amount of rationalizing of expenditures across different programs. But that's, I think we have some of the work that's relevant here from past work is on targeting and on audits. So in Indonesia, for instance, there's evidence showing community monitoring versus government monitoring of, say, large-scale road construction projects, and how to target the right people. So like you rightly said, the inclusion-exclusion errors are a big area of research interest. So especially with the food distribution programs, we've done work in Indonesia on a very large scale. On how to improve targeting and the delivery of programs. That I think is a little bit more closer to being able to advise governments on what to do. But a lot more else, I think we need more research and more partnering to do that.
Fundamentally, there is one issue. I've done this analysis for a couple of state governments. I think latest one was Rajasthan around a year back. We try to analyze around 700 schemes. From both budgeting perspective and also both from the outcome perspective of the department. The biggest challenge we had in identifying which schemes are working, which are not working, forget about even the impact assessment. Simply, is there alignment between the scheme, the department's objective, lot of times we found some of the schemes are spread out in 3 departments. So fortunately, we could do a simple analysis. We didn't even go into details. We said, what is the scheme? What is the guidelines say? What is the department objective? And where is the money going? So this simple 80-20 analysis of budget allocation versus this, we could identify around 200 schemes which did not have any reason to exist. So there is a fundamental problem in terms of trying to look at how the budgets are made by finance and how they are implemented by the administrative department. There's a huge disconnect, and that is where your DBT data is something which will help in understanding why this money is going there and is the output happening or not. Good. But wonderful. I think that some threads will pick up in Punjab, and then we'd love to take it.
Yeah, as you were talking, I just remembered like one other thing on the institutional side. So one is, of course, looking at evidence. One is all the people who are working on the space, whether it is through the collaborators or directly through the government itself, knowing what kind of evidence to look at, differentiating good and bad, and seeing what's relevant to the state. And the other thing, and this is something we did for Tamil Nadu and which we do through the CLEAR initiative, which is our capacity building work, are these guidelines for evaluation. So there, the Tamil Nadu government actually, it was quite, I don't know how much implementation is happening, but in the guidelines, it specifies that certain criteria of programs should either have an ongoing evaluation, or when you put in an expenditure proposal for the next year, it integrates evidence from what has worked and what has not before you put in the next proposal. So, what you also need is that tying up back to finance. And so what happens is your budget cycle is different from your measurement cycle.
Absolutely.
And so those two need to be linked, and that can actually happen only through an administrative guideline, which is simple to do. I think governments will issue it.
Yeah, 10% of the budget, it should be factored for any new scheme that it should be kept aside. I agree. Exactly. I think some of the schemes they've done it, mission mode schemes, but they are not used actually. Budgets are surrendered.
Yeah.
Thank you. Thank you very much.
Yeah, I think we'll have to get back to you on the Bihar question. It's an ongoing study. We can check on the team and with the team and get back to you.
No worries. When you described that it's a feeder network and then they're using an instrument, I was sort of trying to puzzle out what might that be.
I had a question. So you mentioned that a lot of times the whole survey and the process of arriving at recommendations itself takes quite a bit of time, and policy changes might or might not happen, or things may have changed in that duration. Are there mechanisms you have in place to change your the whole research design or program design midway, and how do you accommodate for that? Are you able to use the data you used earlier? Are there any scenarios that way?
Yeah, no, we go through. I think we should be talking a lot more about our failures as well, in addition to our successes. This is a challenge a lot of the times. So we've had cases where, of course, things have changed externally. Like, for instance, obviously, over the last year, just because of COVID, when schools are closed, you just shut down those projects, right? There's not much to do. What we were able to do, I'll give you an example of these early childhood education centers that the government tried to set up, and within 6 months, everything shut down. But in that 6 months, there was a lot of interesting process data that we got just on how they were spending time, how the attendance, interaction between teachers and students. So that sort of summary statistics we've realized is very valuable to the implementer. And so I think there are things to do there where you share those insights and people learn, and at least improves implementation. It doesn't do too much to the research goals, obviously, because then the question remains unanswered. So in a lot of these cases, which we call implementation failure, so there's theory failure and implementation failure when you have no effect. And sometimes your intervention is not answering the key challenge, and that's a theory failure which you learn, and therefore then you have to design something new. A lot of the times when it's implementation failure, where they're not able to sustain the program, or you don't maintain the randomization, the program gets expanded to everybody, or it becomes redundant because of something else. There's a lot you learn on why something didn't work and what those challenges are, and our effort is to really communicate that. But changing the research design mid-course is extremely difficult to do, because everything from sample size, the assumptions that you make, the calculations that you do for why it is set up in a particular way, it becomes difficult. So you either halt the study completely, or in very rare cases are you able to change it, because then interpretation becomes very difficult.
Makes sense. Thanks.
So that's typically what we do. We actually halt the study so that you don't spend any more on doing the question, just to say that, we already know it doesn't work.
Great. So we have 3 more minutes and then we'll be coming to an end. If anyone has any last questions for Aparna, I will ask you to ask them now. Otherwise, Aparna, I have a last comment for you to react to before we close. So I'm going to give 30 seconds in case anyone wants to say something or ask a question.
I have a random observation which might not even be related to our cities at all. So yeah, here it goes, because there are a lot of data geeks here. This is something I've figured. So I'm new to urban, and I know that political parties and politicians do a really good job of segmenting their audiences, and they are able to roll out campaigns to cater to those specific audiences. Whereas government service delivery, for some reason, even though they are the same people who are sitting at the executive powers, are not able to roll out those programs or do the segmentation better, even though they have better access to data. I mean, I don't know if it's true or not. It's something which is stuck to me, and I know it's completely unrelated to this as well, if you want to answer that.
So by segmentation, you're talking about sort of differentiated projects.
No, when they reach out to an audience, purely in terms of messaging, it's purely a marketing segmentation question, if you really think about it, right? So I know it doesn't strike like a question needed to be answered.
No, it's right. Absolutely. I think implementation, we see that especially in a large country like ours, that it is simpler to roll out one program everywhere than to do differentiated work. And we often see this as well. I think some of it is just helping them think through and setting up the systems for it. And a lot of the times it's just that they don't have the systems to send out that messaging and some of that nuance, and which is the targeting work. And we are finding that actually communities, the Indonesia work that I found, that I referred to, communities are better at identifying the poorest among their community than or at least as good as, if not better than, the government, like a questionnaire of categorizing people. So yeah, I don't know why that happens. It is one of the challenges that's there, but it takes some effort to actually curate that and set up the systems. And once they've done it once, then it's easier to do it afterwards.
The thing is, I've talked to multiple folks who've done campaigning, and I was amazed by the kind of data they actually collect and the kind of campaigns that they run. And then I was thinking, hey, when the same guy is actually elected as a representative, they sort of, I mean, that's the only, I don't want to say that's the only skill set they possess, but it's one of the core key skill sets they possess, right? But they're not able to leverage that in the governance context. So yeah, I was just trying to figure why.
Yeah, I mean, some of it could also just be incentives, right? The incentives are aligned in a particular way when
that is true.
Campaigning.
I'm just saying, yeah, you know how to do that, maybe apply that. Yeah. I mean, yeah, still an observation, as I said.
Yeah.
Great. So Aparna, I know we're at 5:30, but I'll ask you to give us another 5 minutes and react to this question. Post-COVID, I think India is going to go digital rapidly. And, organizations like JPAL and organizations like eGov have a lot to do to shape the space. So given your current vantage point, what do you think are the 3 most critical principles we should all be keeping in mind for the next phase of like rapid digitization that we anticipate is coming down the road?
Yeah, I think so. First is, I think, just this data strategy, right? Like digitization and data use as 2 separate things, but very closely linked. And so whatever digitization initiatives we're taking up or that you are collaborating, to have a guiding data strategy with it. And so this was in fact one of the things we've also been encouraging with the Punjab government, is to say you almost have a chief information officer along with a chief technology officer, and you need both of these things coming together. And that's another thing, I really encourage you guys to push on, because, really the value that comes from that. So that data use perspective is the fundamental for me on collecting data for what, and not just for monitoring purposes, but planning and decision making, which is distinct from just checking whether things are going well. Then I think another thing is, of course, that guides the systems and the protocols in place. And there's not just waiting for legislation, but taking some of those steps proactively. And so again, it flows from the data use, right? So what do you need access? What data do you need access to? And setting these rules for collaboration. And I do think that with the next wave of digitization is also the space for collaboration and a lot of interdisciplinary collaboration. So setting those rules of engagement in some ways, and who brings what values and what skills, and how do we actually come together for this greater good, and how do we leverage each other's skills, including government as a player. I think that would be another key thing on trying to break that puzzle or try to unlock that, whereas where many of us are actually working in silos ourselves, just like we're saying, the data is in silos within government. So I think that would be an interesting space to think about more proactively. Yeah, I don't know if I have a third thing, but it would of course be, I think, a plug for making this correction from evidence to action. Is what can we do from really taking those pilots to scale, and that's, I think, really investing in skills and investing in skills of people within our organizations, and building that capabilities within policy partners particularly, so that they're also informed users of information. So it's really not just about data, but it's really about meaningful data and its use. And so having those skills to interpret. So anything that we can do on making that, really starting at schools is often my thing on this whole thing of scientific inquiry and learning, and then really building that at every stage is I think a very big piece to this. And I think that's a big constraint that all of us face, not just within governments, but also within our organizations, on attracting the right talent and building those skills over time. And because with technology and digitization, it moves so quickly that you need to have a learning growth also that catches up.
Thank you, Aparna, and thank you for the conversation. Eddie, back to you.
I think that's all from the question and answer session, Aparna. Thank you so much for taking out the time. And as everybody mentioned, we'll be in conversation with you on many more different threads. And thank you for taking out the time today and speaking to us.
I really enjoyed it. I really enjoyed the exchange as well, and look forward to being in touch. Thank you so much for this platform.
Thank you.
Thank you.
Bye-bye.
Thank you, Aparna. Take care. Bye-bye.
Thank you, Aparna.
Thank you, everyone.